My name is Dr. Marissa Blake, and before we speak about numbers, before we speak about pressure, arteries, or medications, I want you to slow your breathing just a little. Let this conversation unfold the way the body itself changes, gradually, quietly, and with meaning. High blood pressure, what medicine calls hypertension, is not a sudden enemy. It is a long relationship between your body and time. I am speaking to you as someone over 60, or as someone who cares deeply for a body that has lived that long. Because high blood pressure is not a condition of danger alone. It is a condition of endurance, of a heart that has worked faithfully for decades, of vessels that have stretched and adapted to every joy, every stress, every sleepless night, every responsibility you carried without complaint. Most people do not feel high blood pressure. That is its most misunderstood feature. There is no reliable pain, no warning bell, no dramatic symptom that says, something is wrong. And so people assume that if they feel fine, they must be fine. But the body does not always speak in discomfort. Sometimes it speaks in silence. I have sat across from thousands of people who were shocked by their diagnosis. They would say, "But I feel normal," and I would tell them the truth gently. High blood pressure does not announce itself because it is not a crisis. It is a condition of strain, a quiet, constant force pressing outward, day after day, year after year. Blood pressure is simply the force of blood pushing against the walls of your arteries. That force is necessary for life. Without it, blood would not reach your brain, your kidneys, your muscles. But when that force stays elevated for too long, the vessels begin to change. They thicken, they stiffen, they lose the flexibility they once had when you were younger. A young artery is elastic. It expands with each heartbeat and relaxes between beats. Over time, with repeated pressure and stress, that elasticity fades. The artery becomes more like a rigid pipe than a living vessel, and the heart must work harder to push blood through it. This is not a failure. It is adaptation. The heart responds to resistance the way any muscle does. It grows stronger, but strength built under constant strain eventually becomes burden. The heart muscle thickens, leaving less room for blood to fill it properly. Efficiency declines quietly. This is why hypertension is so closely tied to heart disease, stroke, kidney disease, and cognitive decline. Not because something breaks suddenly, but because something is asked to work too hard for too long. Aging itself changes blood pressure regulation. The sensors that once adjusted pressure moment by moment become less sensitive. Hormonal signals shift. The kidneys, which help regulate blood volume, do not respond as quickly. Blood vessels lose flexibility. These are not errors. They are natural changes. But when combined with modern stress, sedentary habits, and long-term inflammation, pressure rises. Many people believe high blood pressure is caused by one thing: salt, stress, weight, or genetics. The truth is quieter and more complex. Hypertension is cumulative. It is the result of thousands of small forces adding up over time. Stress deserves special attention, not the kind that comes and goes, but the kind that lives in the body. Chronic stress keeps the nervous system alert when there is no immediate danger. Adrenaline tightens blood vessels. Cortisol increases fluid retention. The heart beats with urgency even when sitting still. Over years, this state becomes normal and damaging. Sleep plays a role that is often underestimated. During deep sleep, blood pressure naturally lowers. This nightly dip allows vessels to recover, but fragmented sleep, insomnia, or sleep apnea prevent that recovery. The pressure stays high around the clock. The body never fully rests. Movement matters, not because of calories, but because blood vessels are living tissue. When you move, vessels expand and contract. They remain flexible. When you sit for long periods, vessels stiffen. Blood pressure rises not because you are inactive, but because circulation loses its rhythm. Diet influences pressure through inflammation, fluid balance, and vascular health. Highly processed foods create spikes in blood pressure by increasing sodium load, reducing potassium, and promoting inflammation. Whole foods, vegetables, fruits, legumes, healthy fats, support vessel health slowly and consistently. Weight changes blood pressure not by appearance, but by workload. More tissue requires more blood supply. The heart works harder. Pressure increases. Even modest weight reduction can significantly lower blood pressure, not because of discipline, but because of physics. One of the most dangerous myths about hypertension is that it only matters when numbers are very high. In reality, even mildly elevated pressure causes damage over time. The difference between a little high and well-controlled compounds over years. High blood pressure affects the brain in subtle ways. Tiny blood vessels that nourish memory and cognition are sensitive to pressure. Over time, damage accumulates quietly. This is why hypertension is linked to vascular dementia and cognitive decline. Not suddenly, but gradually. The kidneys suffer silently as well. They filter blood constantly. High pressure damages the delicate filtering units. Kidney function declines slowly, often unnoticed, until significant loss has occurred. Vision changes can occur because the tiny vessels in the eyes are fragile. Elevated pressure thickens and narrows them. Vision loss from hypertension is often gradual and irreversible. This is why managing blood pressure after 60 is not about chasing perfect numbers. It is about protecting organs that have served you faithfully for decades. Medication is often misunderstood. Many people fear it means they have failed. In truth, medication is assistance. It reduces the workload on the heart and vessels. It allows the body to function within safer limits while lifestyle changes do their work. Lifestyle changes are not punishment. They are cooperation. Walking regularly lowers blood pressure by improving vessel flexibility. Strength training supports metabolic health. Breathing slowly activates the nervous system that relaxes blood vessels. These are not dramatic acts. They are steady ones. Monitoring blood pressure is not obsession. It is awareness. Blood pressure fluctuates throughout the day. One reading does not define you. Patterns matter more than moments. I want to speak gently to fear again. Many people fear stroke, heart attack, loss of independence. That fear is understandable, but fear alone does not protect vessels. Calm, consistent care does. I have seen people in their 70s, 80s, even 90s stabilize blood pressure, improve stamina, sharpen mental clarity, and regain confidence. Not by doing everything at once, but by doing a few things consistently. Hypertension does not mean your body is broken. It means your body has been working hard for a long time. It asks now for support, not blame. Aging with high blood pressure does not mean shrinking your life. It means refining it, choosing habits that support circulation, choosing rest that allows repair, choosing movement that keeps vessels alive. Your heart has beaten for you millions of times without complaint. Your vessels have adapted to every season of your life. Now they ask for gentleness, rhythm, and respect. I am Dr. Marissa Blake, and this guidance comes not from urgency, but from watching what happens when people stop fearing their diagnosis and start working with their bodies patiently, consistently, and with trust. And trust is not something that appears overnight. It is built slowly, just like blood pressure rises slowly. It is built through repetition, through observation, through learning how your body responds when you treat it with steadiness instead of urgency. I want to stay here for a moment because many people believe that once hypertension is diagnosed, life becomes smaller. They imagine restrictions, limitations, a sense of fragility. But what often happens, when managed thoughtfully, is the opposite. Life becomes more intentional, more measured, and, surprisingly, more spacious. When blood pressure is uncontrolled, the body lives in a state of constant tension. The heart is always pushing. The vessels are always resisting. The nervous system is always alert. This background strain steals energy quietly. People describe it as fatigue, brain fog, irritability, or simply not feeling like myself anymore, without realizing pressure is part of the reason. When blood pressure begins to stabilize, people often notice subtle changes first. Sleep becomes deeper. Mornings feel less heavy. Walking feels easier. Thoughts feel clearer. These are not dramatic transformations, but they are meaningful. They are signs that the body is no longer fighting itself. Consistency matters more than intensity. I want to say that again, because it is one of the most important truths in managing high blood pressure. Sudden, extreme changes rarely last. Gentle, repeatable habits do. A 10-minute walk every day lowers blood pressure more reliably than an intense routine done sporadically. A regular bedtime supports pressure control more than perfect sleep once a week. Reducing processed foods most of the time helps more than strict restriction followed by frustration. The nervous system deserves special care as we age. High blood pressure is deeply connected to how often the body feels on guard. Slow breathing is one of the most effective overlooked tools we have. When you slow your breath, you signal safety. Blood vessels relax, heart rate slows, pressure decreases. This is physiology, not philosophy. Many people are surprised to learn that loneliness affects blood pressure. Social isolation increases stress hormones. The body interprets isolation as danger. Connection, conversation, touch, shared routines has measurable effects on cardiovascular health. Humans were not designed to regulate themselves alone. I want to speak to caregivers for a moment. If you are listening because you love someone with high blood pressure, understand this. Your calm matters. Your patience matters. Pressure is contagious. So is reassurance. When care feels supportive instead of controlling, the body responds differently. Now let us talk about numbers, not with fear, but with clarity. Blood pressure readings are not judgments. They are snapshots. They change with posture, stress, hydration, time of day, even conversation. This is why home monitoring, done calmly and consistently, provides better insight than isolated clinic readings. The goal is not to chase the lowest possible number. The goal is stability within a safe range that protects organs. Especially after 60, overly aggressive lowering can cause dizziness, falls, and fatigue. Balance matters. This is why treatment must be individualized. Age, activity level, kidney function, medications, and overall health all influence what controlled truly means for you. I often remind people that arteries age just like skin does. You would not expect your skin at 70 to behave the same way it did at 20, and you would not punish it for that. Blood vessels deserve the same understanding. Food choices influence pressure not only through salt, but through potassium, magnesium, fiber, and anti-inflammatory compounds. Fruits, vegetables, beans, nuts, and whole grains support vessel health slowly and steadily. This is not about deprivation. It is about nourishment. Alcohol deserves mention here as well. In small amounts, it may relax the body temporarily. In larger or regular amounts, it raises blood pressure, disrupts sleep, and strains the heart. Awareness, not guilt, is what allows better choices. Pain, too, plays a role. Chronic pain keeps the nervous system activated. Blood pressure rises as the body braces itself. Managing pain effectively through movement, therapy, or appropriate medication is part of managing hypertension. I want to acknowledge frustration. Many people do everything right and still need medication. This is not failure. Genetics, aging, and long-term vascular changes matter. Accepting help is not weakness. It is wisdom. What matters most is trajectory. Are you protecting your future self? Are you reducing cumulative strain? Are you creating conditions where your heart and vessels can do their work without constant resistance? Hypertension is not a race against time. It is a partnership with it. Over years, controlled blood pressure preserves independence. It protects vision. It protects cognition. It protects mobility. These outcomes matter more than any single reading. As time passes, people often become more attuned to their bodies. They notice when pressure rises, during stress, illness, poor sleep. They learn how to respond early, gently, before escalation. This is mastery, not fear. I want to leave you with this understanding. High blood pressure does not mean your body is betraying you. It means your body has been carrying you through decades of living, through work, worry, love, loss, responsibility. Now it asks for support in return. Move with intention, rest with purpose, eat with care, breathe with awareness, accept help when needed. These are not medical orders. They are acts of respect, and respect, applied consistently, is one of the most powerful medicines we have. I am Dr. Marissa Blake, and if there is one thing I want you to take from this conversation, it is this. Longevity is not built through fear of the body, but through cooperation with it. Your heart is not fragile. It is faithful. And with steady care, it can continue to serve you well for years to come. I have seen people in their 70s, 80s, even 90s stabilize blood pressure, improve stamina, sharpen mental clarity, and regain confidence. Not by doing everything at once, but by doing a few things consistently. Hypertension does not mean your body is broken. It means your body has been working hard for a long time. It asks now for support, not blame. Aging with high blood pressure does not mean shrinking your life. It means refining it, choosing habits that support circulation, choosing rest that allows repair, choosing movement that keeps vessels alive. Your heart has beaten for you millions of times without complaint. Your vessels have adapted to every season of your life. Now they ask for gentleness, rhythm, and respect. I am Dr. Marissa Blake, and this guidance comes not from urgency, but from watching what happens when people stop fearing their diagnosis and start working with their bodies patiently, consistently, and with trust.